All right, so again, this is Jessica Kaplan. Is this going? Yeah, physical assessment final. Now that my patient has fully fallen asleep on me from all talking, we're gonna get up and we're gonna do some movement. We're gonna be testing, again, using that Glasgow Coma Scale. He is fully alert. He's able, can you stick your tongue out? Perfect. He's able to follow commands. We can do a couple of different range of motion activities. So I'm going to start from the top. So again, with any assessment, you're looking for symmetry, alignment, deformities of bone. Again, when you're doing this type of stuff, you're going to be inspecting and palpating the soft tissue for nodules, muscle atrophy, or crepitus. And you do want to try to assess active and passive range of motion. Also, I'm going to be paying attention to muscle strength, both in tone. So looking at both sides of his body, they're pretty symmetrical. I can tell that both sides of his body are getting used. There's no atrophy. So you also want to be assessing for inflammation, swelling, warmth, or tenderness in areas. So we did earlier, when we were doing your cranial nerves, we assessed your jaw. You were able to open your mouth. That's your temporal mandibular joint. And now we can do your shoulders. So you were able to shrug your shoulders up against resistance during the initial physical assessment. Now we'll do, can you raise your arms out like this for me? Perfect. So we're checking flexion and extension. Can you put them back? Wonderful. You can come back to baseline. And then we're going to do some abduction out and adduction down. So as you can see, both sides are equal. And then can you do a couple arm circles for me? Great. And are you having any pain or discomfort while you're doing that?
No.
No. Good. So I would classify that as full range of motion. And then you can do an assessment. Can you put your arms out against my hands? Perfect. So while we're doing that, we're testing tone and strength of muscles. Now we're going to do your elbow. Can you flex your arms up for me and down? And then can you pronate and supination? Perfect. So he has full use of that radial bone. And then while you're standing like this, again, we're going to test his strength. Can you push out against me? Wonderful. Perfect. Very strong. We're going to move along to the wrists. So can you flex and extend your wrists for me? Perfect. Can you move around in a couple of circles? Wonderful. And then we also want to check the dexterity of his fingers. Can you make fists for me? Perfect. Can you spread your fingers out? Can you close them? Hey, you did really good. I'm proud of you. Can you do this for me?
On both?
On both hands. Yeah. Beautiful. So again, you want to check and make sure that he's got no, a lot of people end up with arthritis, or a really common thing for people nowadays is tendonitis and that trigger finger, because we are doing repetitive motion on keyboards or whatever type of repetitive motion, and having issues with dexterity of our fingers. Can you flex your head down for me? Touch your chin to your chest. Beautiful. Can you look up at the ceiling? Wonderful. Come back to baseline. Can you look to your left? And look to your right. Great. And then come back to your baseline, and can you put one ear to this shoulder and an ear to the other shoulder? Perfect. And then we'll also do your spine. So standing straight, can you, I am going to stand behind you just because you do want to assess to make sure that somebody's spine is straight up and down. Again, scoliosis can be an issue. So can you flex your body forward and bend over and touch your toes? Beautiful. Perfect straight spine. Some of these exercises are easier for somebody to do in the bed. Again, if you're talking too much and your patient's falling asleep, get them up. Can you lift your knee up like this for me? Beautiful. And then you don't have to lift your leg all the way up, but can you extend your leg out straight for me? Wonderful. Some of these assessments are easier done on a bed, like checking for lateral flexation in the knees and the hips. I'll have you lay down in a minute and we'll do some of the hip stuff, but you are able to flex and extend your knee. You want to sit for a second on the bed, and I'll have you swing just one of your lower legs inward and then outward. Beautiful. You can do both ways. Do the same with the other leg, please. Great. And can you point your feet and then flex it up like this? Beautiful. Again, you can't see this at this point, but I'm just making sure that he's able to move his foot the same way that he's able to move his wrist. And then can you invert your bend in at the heel and evert, bend out at the heel. Perfect. And do the same with the other foot, please. Great. Full range of motion in both legs. So I will have you laid down for a second. I'm gonna move the camera back over here for just a few moments and do some of your we'll do a couple passive range of motion. So I'm trying to check his strength, but I also want to be feeling for any type of clicking or popping or resistance. So you don't resist against me. I'm just going to passively move all your joints. Great. So I don't feel any popping or clicking. And again, comparing both sides. The distal phalanges are important to assess, especially for things like arthritis. I'm going to do the same with your legs, so don't resist against me. Perfect. And again, assessing both sides. Can you pull your right leg into your chest for me? Great. And you can extend it back out and do the same thing with the other leg. Wonderful. So again, your patient might not be able to do this, and that's okay. That might be their baseline. And then can you, I'm going to just position your leg so that your leg is up like this. And can you splay your legs out that way for me and then pull them in? Perfect. So this is just assessing the hip joint, making sure that he has full range of motion. And that is about it. Do you have any questions for me?
No, how'd I do?
You did really well, thank you.
Oh, my pleasure. Thank you, Nurse Kaplan.
Anyway, thank you. I hope that was informational, and have a great night.